Hello students, welcome to this session. Today we will have lecture on leukemia. So what is the definition, classification, the clinical features, that means symptoms of the patients, and then how to lab diagnose the leukemia. Now let's see one case why CBC parameters are so important. So a young boy, he's B chemical, he came to Bombay for job. So in that medical examination done and CBC advised. So he came to Nanavati hospital lab and then CBC is done. So in that the first CBC count, that is the total WBC count, was 74,000 cells per cubic millimeter. Then peripheral blood smear report done, and in that many blast cells seen. So bone marrow aspiration and bone marrow biopsy advised, and it is done. And the person diagnosed as AML, that is acute myeloid leukemia. Then few cycles of chemotherapy given. Then because he was very young, so bone marrow transplantation advised. So he has six brothers, so one brother's bone marrow matched and then transplantation done at Tata hospital. After few months he came to Nanavati hospital again for the CBC investigation, and that time it was a normal report. So because of the CBC, the person got diagnosed AML earlier, and then he got treatment earlier and then early cure. That is why CBC is very important. So in CBC, what are the CBC parameters? So it is hemoglobin, total RBC count, total platelet count, total WBC count, then differential leukocyte counts. In that we can see agranulocytes like lymphocytes, monocytes, and granulocytes like neutrophil, eosinophil, and basophil. And RBC indices, in that PCV, MCV, MCH, MCHC, and RDW can be seen. So all these parameters we can do manually, but because of the calculations it takes longer time. So nowadays, because of the advanced automated cell counter system, we can do all these parameters within a minute in one aspiration in the cell counter. So definition of leukemia. So this is abnormal proliferation of the hemopoietic cells, that is abnormally hemopoietic cells, that is precursors of the RBCs, WBCs, and platelets, that is the immature forms of all these blood cells. They are abnormally increased, and then because of that they infiltrate into the bone marrow, and then the process of differentiation in leukemic cells is often abnormal and is commonly result in immature morphological appearance. So they are also called as blast and the other forms of the immature cells. So that abnormal proliferation of the hemopoietic cells is called as leukemia. Now we will see etiology. So what is the reason for that? So it can be seen because of the alteration of structure of DNA in the nucleus, and then chromosomal abnormalities like very common in leukemia, and then because of the radiation or chemicals like benzene, so people working in benzene factory, or few viruses which are causing this leukemia, and then some genetic factors are there. So these are all the etiological factors which are responsible for the leukemia. Now we will see classification of leukemia. So they are classified as acute and chronic according to the clinical symptoms of acute onset or chronic disease. And then they are divided into myeloid and lymphoid type according to the cell line, that is morphology of the cell line involved in the leukemic process. So leukemia is classified as acute when more than 30% of the bone marrow consists of blast cells. And then it is divided into acute myeloid leukemia or acute lymphoblastic leukemia according to the series of the myeloid or lymphoid series involved. Then chronic, when the less than 30% of the bone marrow consists of blast cells, it is called as chronic leukemia, and again it is divided into chronic myeloid leukemia or chronic lymphoblastic leukemia according to the series of the cells involved. So now acute leukemia is divided into two types, acute myeloid leukemia and acute lymphoblastic leukemia. So now acute myeloid leukemia is divided into 7 types. So they are labeled as M1, M2, M3, M4, M5, M6, M7. So M1 is myeloblastic leukemia without maturation. M2 is myeloblastic leukemia with maturation. So nucleus is matured in the M2 type. Then M3, hypergranular promyeloblastic leukemia. M4 is myelomonocytic leukemia, M5 is monocytic leukemia, then M6 is erythroleukemia, M7 is megakaryoblast leukemia. Then acute lymphoblastic leukemia are of three types: L1, L2, L3. So L1 is small lymphoblast, they are homogeneous, so all are the mostly small lymphoblast. L3 is large homogeneous lymphoblast, and L2 is mixture of, that is heterogeneous, so it consists of small plus large lymphoblast. Now chronic leukemia, so it is chronic myeloid leukemia or chronic lymphoblastic or lymphocytic leukemia. So clinically patient is presenting with acute leukemia. So most common symptoms are anemia, fever, malaise, bleeding, that is hemorrhage, bruising, pateki. So bleeding can be from the gum or from the nose or from the skin. Then less common symptoms are infection of the mouth, pharynx, pain in bone and joints, mainly in childhood, upper respiratory tract infection, mainly in childhood. Now we will see lab diagnosis of leukemia. So investigations can be done. So routine investigation like hemoglobin, CBC, ESR, PBS and platelet count. So in PBS then we can see morphology of the cells. So it is RBC, microcytic anisocytosis, that is variation in size of the cells, poikilocytosis, that is variation in shape of the RBCs, then normoblast, that is nucleated RBC, that is immature form of the RBC is seen, polychromasia, that is purple RBCs, then increased retic count is there. WBC total count is markedly increased up to 1 to 4 lakhs the cells per cubic millimeter can be there. In differential count, major cells are blast cells, so more than 30%, or mainly cells are blast cells, either myeloblast or lymphoblast according to the acute myeloid or acute lymphoid series. Then platelets are increased, so it is hypercellular response. Then we can do bone marrow for the confirmation. So bone marrow is hypercellular, so all the many cells are there, and then the fatty area is less. Then in acute leukemia more than 30% myeloblast cells are there. In chronic leukemia less than 30% blast cells are there. In chronic myeloid leukemia cells of myelocyte series are increased, and basophilia is also there. These are my references from where I have taken my notes, and I hope you find this session very useful for your academics and for your future practice. Thank you so much.